So as y'all know, I'm Dr. Rosen. I'm the Director of Radiation Oncology for the Willis-Knighton Health System. And today's a really special day. Today we're here to celebrate a milestone in our cancer center and for proton therapy in the country and around the world as we celebrate the delivery of proton therapy for our 1,000th patient. Our honoree today is Michael Phipps. Michael's just completed proton therapy in our department. He is joined today by his wife and many members of our radiation oncology department and team. Michael, it's been a real pleasure having you here. We feel very fortunate to have for you to have allowed us to be involved in your care. Our team here is going to always be here for you. In 2006, when we started imagining proton therapy in Shreveport, there were only 6 facilities in the United States that offered proton therapy. Each of these facilities were about $200 million, and they required space about the size of a football field. We explored the concept of bringing a smaller, more compact, and more affordable form of proton therapy to Shreveport, the type of protons that could be done in a community, but academically minded cancer center. Our double accredited department at that time had already become a recognized leader nationally and internationally for intensity modulated radiation therapy and image guided radiation therapy, as we were early pioneers in the treatment of both of those technologies. But we knew that we needed a proton therapy unit that could build on our experience here in Shreveport. That began over a 6-year journey, leading us to Belgium and ultimately to signing a contract with IBA to be the world's first Proteus One. In September 2014, 11 months after we installed our gantry, which in itself was a world record, we treated the first patient in the world on a commercial compact scanning image-guided proton therapy unit. It was revolutionary. Willis-Knighton became the 15th proton center in the country, and we were offering this treatment 1 to 2 years before centers like Mayo Clinic, Johns Hopkins, Memorial Sloan Kettering, St. Jude's, a few of which traveled to Shreveport to see our technology. Since then, we have hosted the world's largest proton therapy users meeting, where we had hundreds of attendees from numerous continents. We've served as a training site for proton therapy centers in Spain, in the United Kingdom. We've welcomed experts from Brazil, sponsored by the IAEA, or the International Atomic Energy Agency, in preparation for Brazil offering proton therapy. And dozens of hospital teams from around the world have traveled to Shreveport to see if they could offer this life-saving treatment to their own patients. In 2019, we were very honored to be the recipients of the George Starkslow Award from the American Association of Physics and Medicine for the outstanding medical physics publication in the entire country, where we described the commissioning of the Proteus One proton therapy machine. Dr. Jay Flans, who's the clinical director at both Harvard and Massachusetts General, president of the Proton Therapy Cooperative Oncology Group, and author of the recent particle therapy technology textbook, said, Willis-Knighton democratized proton therapy for the United States. In our department, patients are treated for protons for anything you can think of, from prostate cancer, lung cancers, head and neck cancers, brain and spine tumors, GI, GYN, breast cancers, and of course, pediatric cancers, where proton therapy has been the standard of care for some time. Proton therapy was brought here with great support of the Willis-Knighton administration, formerly from Mr. Jim Elrod, and with continued support from Jeff Fielder and all of the Willis-Knighton leadership. You don't put in proton therapy without a commitment from your administration. We've made particle therapy accessible to surrounding hospitals with referrals, both locally from around the country and even internationally. We've made efforts to keep proton therapy affordable, and we were recently identified in a large review article in PRO as having the lowest Medicare cost per patient for proton therapy of any facility in the country. To reach this milestone would have been impossible without the outstanding dedication of all of the members of our team. And that's from across the spectrum. I mean, that's from every part of the department, from complex billing associated with proton, all of our administrative staff, our support staff, our clinical team, the physicians, the nurses, the physician assistants, and especially due to the efforts of our excellent physicists, dosimetrists, and our dedicated radiation therapy technologists who put in so many long hours to make sure our patients do well. This assembled team, many of them who are here today, is as strong as any exist at any facility in the world. And although I am biased, that has been demonstrated time and time again from external reviews from around numerous sources. I would like to thank all the members of Radiation Oncology for your contributions that helped us get to number 1,000 today. And finally, the reason that we do this, and all of us know this, is for the patients themselves. It is our honor and privilege to be involved in your care. Patients with cancer, strength is what keeps us going and motivates us to do what we do. Thank you for your attendance today.